welcome to the November board of CQC. We have no apologies for absence. Are there any interests that need to be declared? Good. I will move on then, and I particularly want to welcome Beth Matthews from our LGBT plus network. Beth, you're extremely welcome today. Thank you for joining us. I'll welcome other people that join us as we go along. The minutes of our 21st October meeting, they're true and accurate record. Thank you very much. There's only one matter in the action log, and that appears on our agenda for today, so we can take that as noted. Is there anything arising that's not otherwise on the agenda anybody wants to raise? Good. In which case, Ian, let's move straight to the executive team report, please.
Thanks, Peter. Good morning, everybody. I think there's a number of things I wanted to talk about today, but I think I wanted to kick off really with a broader statement that I know colleagues will contribute detail around, which is that we have continued to regulate during the second wave of COVID, as we did with the first. But what we have not done is we have not restarted any routine activity. I think that's really important to say, because I know there's been some reports in the media and some provider groups have written to us asking for clarification on that point. And I think it's worth just making that really clear public statement again, that we have not restarted routine activity. But that is not to say that we have not been continuing to regulate, and I'll go on and talk a little bit more about that in a moment. I think the other thing that's worth just flagging at the moment is that although we are not routinely rating services, we do know how important ratings are. So in a small number of cases, we have re-rated services where we've been able to get on site perhaps, or we've been able to look at specific pieces of information which has enabled re-ratings to take place. But we are behind the scenes working hard on a proposition, if you will, for what ratings might look like in the future, because we're conscious that that having been locked down in various ways over the last few months and not having routinely rated services since March, that is not a sustainable position. But we do want to make sure that any proposition around ratings is meaningful to the public, and of course it's meaningful to providers as well. So we will be bringing forward to the board some proposals around how we might rate using new methodologies and how we might do that going into 2021. So it's worth just, I think, noting that, because I know particularly providers have said to us that they're very interested in ratings, that some of them want to be re-rated and feel now is a good time to re-rate. I think that's probably not a view we necessarily share, because our rating methodology it does mean that we'd have to go on site and we'd have to do a fair amount of work, and that could be disruptive in some quarters. But we're looking for ways to have a ratings proposition that's consistent with our ambitions in our upcoming strategy. Our work over the last month has, as it did at the tail end of the summer, focused on infection prevention control in all of our sectors, and also looking at the higher risk settings in each of our sectors. And this is part of the wider government efforts to both combat COVID, but also send a clear message to the public that the health and care services are open, and that they're open for non-COVID conditions just as much as they are for COVID conditions. And again, I think that's an important public message that we want to send, that if people do feel they have conditions that are non-COVID related, they should go and have them checked out by professionals. The other thing we've done is we've paused our provider collaboration reviews for between about 4 and 6 weeks, and that was disappointing on one level, because we know that that looking at how providers were working and collaborating together during COVID is going to inevitably unearth some powerful and very practical lessons for providers to use. But we haven't been able to do that because providers, as they've gone into that second phase of COVID, I've just been unable to commit the time to do the work with us to do that. This is very much a recognition of systems under pressure. I think increasingly systems are talking about being under pressure as a combination of COVID, winter pressures, plus planning for exiting the European Union, which of course is coming up is coming up shortly. So I think blending those three things together means that the providers in different ways are certainly feeling the pressure, and we want to make sure that as a regulator we are fulfilling our purpose to the public, but at the same time also recognising that pressure. We've also commenced work on a thematic review, a so-called Section 48 review, on behalf of the Secretary of State on do not attempt cardiopulmonary resuscitation and advanced care planning. That's a topic which has come up a number of times during the COVID period. And although our view is that inappropriate DNA CPRs are relatively rare in terms of the number of times we've been advised of that, we are doing a report, and there'll be an interim report coming up shortly before Christmas, and then a longer term report in February, which will talk to that topic, and we hope will raise the topic in both in the minds of the public, but also in the minds of professionals, and talk about good practice and what good practice might look like. I think it is worth saying very clearly, though, that that thematic review will not be a comprehensive review of every DNA CPR that's in place. It's explicitly not doing that, because the Secretary of State has asked us to do a very quick and clear piece of work, which with the focus on what good practice looks like. We've also been doing a lot of work on talking about our strategy. The ET have held a series of webinars. A number of us have been talking in virtual conference stages and so on, talking about our strategy as part of this work that we're doing at the moment, which is a discussions phase where we're going out to providers and the public and talking about what our strategy might look like, with a view to a consultation to commence in January. I think we've had some very useful specific feedback on the documentation, but one of the things that's been quite striking about all of the work we've done is the very widespread support for the direction of travel. Big focus on how we can support providers to improve. Big focus on the importance of safety and the fact that learning is required in order to deliver safe care. These are things which come up again and again as being things that stand out in the strategy for people, whether that's the public or providers, and that I think is a really good place for us to be, and I look forward to the formal consultation and the adoption of the strategy in the early part of next year. In terms of work we're going to be doing in the coming month or so, I think a continued focus on IPC and also continuing to focus particularly in social care on the designated location scheme, where as part of the government's winter plan, the government have asked us to inspect a number of locations that are nominated by local authorities as a safe location for somebody who is medically fit to be discharged from a hospital but is still testing COVID positive. So a relatively small number of people in absolute terms, but an important group of particularly vulnerable people, and we're working alongside governments to help designate these places so that people are clear that they are a safe place for people to be discharged to. I think in overall terms, our work since in the most recent lockdown is quite different to wave one, in the sense that in wave one, I think all public entities, in fact all of us in society, were unsure where COVID was going and the impact it would have on our daily lives. I think we're all now more confident that we understand COVID. It doesn't make it any less infectious or any more difficult a virus to deal with, but at least we understand how we should deal with it. We've now got some strong tools in our toolbox, as it were, and I pay enormous tribute to the many members of the team who are out there every day, going through the door of places that they know have COVID in them, and they're going out and offering the public that really clear assurance that these services are as safe as they can be in the circumstances that we find ourselves in. So, I know other board members will join me in that enormous thanks to the way the teams are really stepping up and are enthusiastic, to be frank, because they believe in what they do and are determinedly wanting to contribute to that broader national effort. I also just want to just let the board know that we are supporting the wider DHSC efforts on standing up a mass vaccination program. So our teams, particularly in registration at the moment, are starting to work out how to support that wider effort. We've already published our latest guidance on mass vaccination on the website for GPs in particular. So again, with the GP community, I know are going to be significantly involved in delivering the program, but there will be others that will be delivering the program as well. As yet, we don't know exactly who and when, but we stand ready to act very, very swiftly to make sure that we can give the public confidence and assurance that the vaccination program is safe and the way it's delivered is appropriate. And then one final thing before I finish, which is asking the board for specific approval, which is the responsible officers statement that is attached to the report. Each year, the board are asked to approve the responsible officers report. Dr. Nigel Aitchison is our responsible officer, and we have to make a return to NHS England each year to say that doctors' revalidations are up to date, the doctors that we employ are fit to practice, and that we have no concerns. I can confirm that we have no concerns, and revalidations are up to date, and we believe all of our doctors are fit to continue to practice. So this is as part of an annual process where we submit a statement of compliance to NHS England. So I'd ask the board to approve that statement of compliance. So that's all I've got to say, Peter, before handing over to Kate.
So can we just formally approve the report? We've all seen it and read it. So everybody happy to approve it? Excellent. And Ian, thank Nigel for that particular part of his responsibilities. That's great. So where are we going next? To Kate, are we?
Kate.
Ian? Kate.
Yes, thank you.
Thanks, Ian. Thanks, Peter. Morning all. So I'm just going to give you an update on infection prevention control in adult social care. This is a feature of our session this morning because it features heavily as well in the Insights report we're going to be hearing about a little bit later this morning. So as you remember, we developed a new methodology back in the summer to look at 8 areas of assurance, our 8 ticks of assurance when it comes to what are the ingredients that need to be in place to support care homes to be as robust as they possibly can about good infection prevention and control. We undertook some thematic work in the summer where we looked at what best practice was. So we went out to 301 good homes as well as 130-ish risk-based IPC inspections, and the findings of those are in the Insights report that we will be discussing today. In addition to that, so we did that original piece of work. We committed to continuing to provide a significant focus on IPC. And back in the beginning of October, we committed to doing 500 infection prevention control inspections through October and November, which included the designation schemes that Ian talked about. And this is in addition to a commitment we made to do, on average, about 300 risk-based inspections as well. So we've set ourselves some targets during October and November that I'm really pleased to say we are exceeding. So as we stand now, we have completed 492 IPC inspections, and we will have completed 520 come the end of November. These are a combination of things that have triggered these inspections. One of the main triggers is we have committed to prioritising going out to care homes where there has been an outbreak that's affected about 30% of the residents. So we're really keen that we get out and we look at what's happened in those scenarios. Have the service done everything they could have to have prevented it coming in, and most of the time that's what we found that they have. And I think it's also important to note, it's flagged up in the report, that outbreaks are occurring in services of all different quality ratings, so from outstanding through to inadequate. So there isn't a correlation, and a significant correlation between the quality of service and whether they get COVID. What we're seeing now is what we saw back in the summer. So and it's in our Insight report, so we are broadly seeing providers doing a fantastic job of managing good infection prevention control. Where there are weaker areas, they tend to be around policies and procedures. So really encouraging providers to have the most up-to-date policies and procedures that reflect the current pandemic we're in. And then the other area that needs absolute vigilance is that consistent, effective use of personal protective equipment. So the same themes that we report in Insights is what's the live issues that are coming out of our IPC inspections as we do them now. And then our designation themes, as Ian said, this was government. This is helping the government implement their winter plan. We have committed to, when a local authority identifies a service to us, within 24 hours we get in touch with that service to check out that they are aware of the referral and to ask them preliminary questions to give us some confidence that they are likely to be assured when we go out and cross the threshold. Then 48 hours after that contact, we are going out and completing the inspection and informing the Director of Social Services whether we can assure it as a designation scheme. So just to make the distinction, we're using the IPC methodology, the 8 ticks, but there is an increased focus on inviting the provider to demonstrate how they can zone the group of COVID residents, COVID positive residents, so there isn't the risk of it being passed to other residents, but also they can provide a kind of bespoke workforce, a bespoke team of staff. So again, the risk of any cross infection is absolutely minimised. As of now, we've done 89 of those designation scheme inspections, and I am absolutely confident that we are responding within those timelines that I've given you. So there is absolutely no delay from our perspective about responding and getting out and inspecting designation schemes. And when we are declining, a small number of these schemes are being declined at the point of inspection, and that's usually because we can't be assured on that distancing point. So we can't be assured that that group of people are sufficiently in a separate enough environment, or we can't be assured around the ability for the workforce to be separated out effectively. And if I can just finish off by saying many of ASC inspectors are doing about 2 inspections a week, where their only job is going in and inspecting COVID positive environments. They want to do it, they are eager to do it, they absolutely think it's the right thing, they're delivering our purpose, but it comes with the anxiety and all the other stuff that our frontline health and social care workers are experiencing day in, day out as well. So on this occasion, I'd just like to say a specific thank you to colleagues who are getting out there and doing what we need them to do, which is going into these COVID positive services and inspecting them.
So, Kate, I see everybody nodding, so I think the whole board wants to thank our colleagues for doing this, but also I think thanks very much for the way that everybody's responded so flexibly and urgently to the other work. So really good stuff. Thank you. Right, we'll go on to Ted, I think. Ted.
Okay, thank you, Peter. Just from the hospital's perspective, there's some details in the written report, but I just want to highlight a few areas which I think are increasingly important. We are, of course, in the middle of the second wave of the COVID pandemic, and services in some acute trusts across England are under severe pressure because of that. They're under pressure from the rising tide of COVID patients, which are going up in hospitals day by day at the moment, and from the winter pressures, the normal winter pressures, which typically start becoming really significant at this point in the year anyway. So we're really at the time where we're beginning to see the COVID pressures and the winter pressures coming together to put a real pressure, a real challenge for frontline services in the NHS. And I think it's really important we monitor things very carefully. And I'll just explain some of the things we're doing about that. But first of all, can I just express the point that this wave of COVID is different to some extent from the previous wave. Firstly, because treatment for COVID has improved, and so fewer patients are being admitted to intensive care. So the pressure is more at the front door than in intensive care services, as it was unlike the first wave. And secondly, hospitals are working very hard and I've seen this in speaking to them, to try and maintain non-COVID services. And so I want to pay tribute to the work the hospitals are doing to try and maintain those non-COVID services for people who don't have COVID but equally urgently need care. In the Insight report that the board will be looking at later on, we have some details of our survey from patients during the first COVID peak. And it's interesting response back from patients, which perhaps talk about later, but just highlight 2 points. One, patients were generally very positive about their care during the COVID pandemic, during the first peak of the COVID pandemic, but there was particular concern about discharge arrangements. Patients not getting the discharge, services not being arranged for them at the time of discharge. And that was particularly true of patients who were suffering from COVID rather than non-COVID patients. And I think there's an important message there that the response to COVID has to be a whole system response, not just a hospital response. And I think that is a really important message. Over the last month, my inspectors in hospitals have been using the transitional monitoring approach to contact all acute trusts to find out how they're using our patient first resource to make sure they're managing the front door of the hospitals and the flow of patients through hospitals most effectively. And we've got a lot of insights into how they are doing that. And I think the feedback we're getting from trusts is that this is really very positive. I suppose the important message I'd like to emphasise is this is a resource not just for emergency departments, but it is for the boards of trusts and for the systems that support those organisations. We cannot manage this just at the front door. It has to be managed as a whole hospital, a whole system response. And I'm increasingly concerned about the pressure on A&Es in some parts of the country. And we are seeing some very prolonged ambulance waits for patients to be handed over to the ED, and those are getting more severe at the moment. In past winters, we've made our position on this very clear. It is unacceptable to become normalised practice for patients to be kept waiting in ambulances when they need admitting to hospital. It is absolutely essential that the hospital assesses the most effective, safe place for that patient to be. And the most safe place for that patient to be is very rarely going to be in the back of an ambulance waiting on the tarmac outside the front of the hospital. There must be other places in the hospital they can be more safely cared for. And so normalisation of keeping patients in ambulances is unacceptable, yet we are seeing longer ambulance waits, sometimes for many hours for some patients, which is clearly totally unacceptable for them. We are monitoring the situation very carefully. The patient first resource is there for people to use, and we think it will make a real difference. There's a focus there on how they manage flow, but also how they manage flow while maintaining good infection control, which of course is essential in these circumstances. We are going to be undertaking some emergency department inspections over the next few weeks, as we did last winter, and we'll be focusing on the patient first guidance to make sure people are using it effectively. And we are reviewing that on a continuing basis. We, of course, also continuing our inspection programme in response to risk, as we've been doing over the summer, and we're particularly targeting inspections on infection control issues more widely across trusts, and we'll be doing infection control inspections of trusts going over the next few weeks. And, of course, we're following up on the issues around maternity safety that I've discussed with the board report before. In mental health, we are continuing response-based inspections, particularly focusing on what we know are high-risk services, such as those inpatient services for people with learning disabilities and autism. And we'll be continuing that through the pandemic, making sure that people are kept safe. I would just like to reiterate what Kate said and what Ian has already said, that our teams are really working very well. They are enthusiastic about going out there and undertaking the actions that are necessary to preserve safety for people using services. And I think I'm really impressed by the work they've been putting in over the last few weeks. In terms of the work around patient first, that has gone really very well indeed. And I think there's been a lot of effort and a lot of innovative practice within the teams. So I'd like to congratulate them on that.
Ted, let me just check nobody wants to come in. I mean, it does seem to me this is really important, and the point you make about the ambulance handover times is really critical, isn't it? Because not only is it not a good place for the patient to be, but it is also an ambulance that is not able to be doing what it's supposed to be doing if it's just parked outside a hospital. So I think that's something we really need to be focusing on, which obviously you are. Right.
Rosie next, Peter.
Yeah, thank you. Rosie.
Thank you, Peter. And can I just also echo my thanks to our teams as well, adding to Ted and Kate's points. They have adopted new methodologies with enthusiasm. They're rolling out the TMA. They're out there inspecting. And so can I add my thanks to the teams as well, because they are working very hard under challenging circumstances and doing a fantastic job. And on that note, the TMA we're rolling out in all of the sectors in primary care. We're getting good feedback from many of the providers we've spoken to with the call around the TMA, who've been very positive, found it a really good opportunity to reflect on what they've been doing, and found it an opportunity to continue to build those relationships with our inspectors, and for our inspectors to identify areas that could be improved or areas of concern. So that is going very well. I just wanted to pick up a couple of things following on from what Ian was saying. One is around the DNA CPR review. This is progressing very well. We now have an agreed scope, an agreed methodology. We have identified 7 areas, 7 CCG areas across the country, one for each of the regions, based on a whole variety of factors, and those regions have been informed. And our methodology will look at both what we find at national data level, right the way through all of the different layers of the system, right down to what's very important in terms of hearing lived experience from patients and their families, and case tracking through different parts of the system, so we can identify what someone is experiencing, and really look at how DNA CPRs are done in a person-centred way. And I just wanted to emphasise the importance of people having those discussions, having advanced care planning discussions. I think our review is very much looking at finding the best practice as well as the learning, because for when it's the right time and it's appropriate time, and when someone feels ready, and provided it's done in a very high quality way, those personalised discussions about what someone's wishes are, with a person feeling very informed and feeling able to think through those wishes in a very informed way, are really important. And we want to make sure that people feel encouraged, if it's right for them, to go and have those conversations with professionals, but they need to be done in a high quality way. And our review very much wants to look at highlighting best practice, as well as highlighting all of the learning where things don't go quite as well. Finally, about the DNA CPR review, I'm absolutely delighted that Robert Francis has agreed to provide non-executive director sponsorship for this thematic piece of work, and we're really pleased to have you providing that leadership for us, Robert. So thank you very much for that. Just the other couple of things just to briefly mention. One is that we have now finished the fieldwork for the PCR programme in urgent and emergency care, so we're looking forward to reporting that to you in the near future, and that's gone very well. And I just wanted to also mention vaccination. It's clear from the discussions that primary care is going to play a critical part in the vaccination programme over the coming few weeks. We are aware that primary care is under a huge amount of pressure, as with other parts of the system, and as Ted has indicated with the A&E situation, we know demand is going up in primary care. So we're working closely with all parts of the system to understand the implications of the vaccination programme, and how we can make sure that people continue to get safe, good care in primary care during that period of time. And in particular, we know that some patients did not choose to attend primary care during the first wave of the pandemic, and stayed away when they had symptoms. And what we would continue to reiterate is, please, if you have symptoms that are not going away, or symptoms that are worrying you, please, as a member of the public, please do go and see your GP about them, because it's really important that they get checked up. Thank you, Peter.
No, thank you, Rosie. Nobody wants to come in, so Kirsty.
Thank you, Peter. Just a really quick one from me, which is the increase in the living wage. The living Living Wage Foundation have increased the living wage to £9.50 an hour. Our G grade is currently at the old rate of £9.30, but we did agree with the unions when we did the pay award that we would uplift any people on that band to the minimum wage, to the living wage when it came out. So just to update you that that's what we've done.
Great, thanks, Kirsty. Mark, is there anything you want to report on cyber, or are we okay?
We're okay. I'm pleased to report there's nothing to report this month.
That's the sort of report I like on that subject. Thank you very much indeed. So let's go over, Chris, to you and strategy.
Okay, so a couple of things just to talk through. Ian's mentioned the first one already, but we've launched a discussion document with colleagues. Just want to give a few stats on how we've reached so far. In terms of the public, we've had a mixture of one-to-one conversations, focus groups and webinars and surveys with over 5,000 members of the public and groups that they represent. With providers, we've held live webinars with over 4,500 providers. In addition to that, we've also had people downloading the events afterwards and almost doubling the reach of those events. We've also conducted some surveys, and we've had a series of podcasts which have had really good traction. The important part for me is that we've had a really good response to some of the themes in the strategy, and particularly in the Critical Friends session we held with over 50 strategic partners. There was lots of support for the key themes of the strategy, in particularly around how we weight for people, how we weight public experience and people who use services against the other information that we hold, in terms of smarter about how we can be more responsive with the data that we hold and that others hold, so we can use not only what we gather ourselves but how we use information from other colleagues. Lots of really strong support for local collaboration across in local areas about how we share that information and form views. Around safety, a particular support for the idea of learning as a key component of how organisations improve, and an open safety culture that supports the ability to learn. And in terms of improvement, developing an appropriate improvement alliance with different groups in different sectors. There was a recognition in this particular one that a one-size-fits-all approach wasn't appropriate, but there would be a logical support for us to work with organisations to help support improvements in different sectors that we regulate. So I just wanted to sort of give you a sense of first of all the breadth of activity and also the positive support. As you know, we'll continue to have those conversations, and our aim is to go out to a formal consultation, taking all that on board in January, and that will be our sort of formal consultation in a lead up to the launch of the strategy in May. Just a couple of other things in terms of parliamentary activity. We're, as part of the Health Select Committee inquiry into workforce burnout and resilience, we're able to secure time for 3 of our DCIs to speak to the committee to provide background that will help in the conversations they are continuing to have with different parts of the NHS and also other stakeholders. Just to give you an update and give feedback, okay, I know Kirsty mentioned it earlier, just to say that in terms of the campaign and the work that we've been doing, we've received recently about 85,000 views from people, which is a massive increase in terms of the number of people that have given their views to give feedback on care. It's dipped in some areas but grown in others, and I think we're learning about how to continue to promote this. What I'm really pleased about is how we're using that information to guide our responsive inspection activity, and I think there's an important point about how we continue to make sure that we do that. As Ian says, we're not going into routine inspections, but using this information alongside the other information and data that we hold to guide our thinking, alongside whistleblowing information which comes from frontline colleagues who work in health and care. So I'm really pleased by the way in which we've begun to use that. There's more we can do with that to make a difference, I think, but it's a really good start and a really good, both the technology around it from the teams working across CQC to support that, but also the ability to reach people with the campaigns, I think is really a really positive piece. Before I talk about what's coming up, I'll just hand over to Kate, just quickly talk about the RSS report, Kate, if that's okay.
Thanks, Chris. So you'll remember at last board, it was the day before we were due to publish our report into restraint, seclusion and segregation, which is called Out of Sight, Who Cares? So the report published, and just to give board a flavour and people are listening a flavour of what that report tells us. So it was commissioned by the Secretary of State back in 2018. It tells a story of missed opportunities for children with learning disabilities and autistic people, about having access to early diagnostics, about health and social care and education working well together. And then it goes on to reflect on comments we've made in last year's State of Care about the absence of a community crisis response, a consistent offer of that around the country. That means that often adults at the point of crisis are not being supported to retain living in their usual place of residence, but instead, for some of them, they are being moved a couple of hundred miles away from their home and from their communities into inpatient units. So just to bring this to life for board members, what we found during Out of Sight is we found examples where at the point of admission to hospital, so if you've been to hospital or a loved one has been to hospital, you would expect on arrival that you would have an assessment and you would have a diagnosis and you would receive a treatment plan, you would be supported to get better, and then there would be lots of focus on getting you back home. Now, we found far too many examples where that was not the case for adults with learning disabilities and autistic people in inpatient units, and that's got to change. We also found a culture of restrictive practice in these establishments, which is a human rights issue. So we make a series of recommendations. There's work that we need to do differently as a regulator that's already underway, and we will focus on at next month's board when we also talk about the Glynis-Murphy findings. But there are two really key recommendations that need to be implemented to finally get the changes needed for this group of adults. So as we sit here today, about 2,060 adults with learning disabilities and autistic people are in inpatient units. So we're calling for a National Commissioner of Complex Care. So currently these inpatient beds are purchased sometimes by specialist commissioners nationally, sometimes by local clinical commissioning groups and sometimes by local authorities. And actually we need all that money pulled together so that there is that right community offer up front that delivers better outcomes for people and costs a lot less than the average of £2,500 a day for an inpatient bed. And we're also calling, a week for an inpatient bed. And we're also calling for a minister to have oversight of this work, so we finally see the movements that is needed on this agenda. Thanks, Peter.
Just to do a couple of things on the one that's come out. So the Untitled Report is our annual report on ionizing radiation. So basically, how we view the issues around scans, etc. So a great example of a report which focuses on learning from safety. This year's report particularly focuses on how services respond to COVID. I say it's a great example of looking at incidents and looking at what can and has changed as a result of those incidents. Finally, just in terms of reports that are coming up, we've got a community mental health survey, the mental health report itself, and also looking at how organisations have innovated and adapted in the response to COVID. All those reports are due out in the next 4 weeks. I think there's a separate agenda item where I'll talk a bit more about the Insight report. So back to you, Peter.
So I have to say, Kate, I mean, I read, as does everybody, a lot of reports, both our reports and other people's reports, but I don't think I've ever read a report that was more shocking than the Out of Sight report and the case studies in there. And I do hope it's taken really seriously, because it's shocking, is all I can say. Ted?
Well, I just agree with you, Peter, about that, and I have to say it is an eye-opener for many of us. And again, it is the parents and families that have been telling us this story for so long, and the system has not been recognising the problem. And that's so often the story when things go wrong in healthcare. But I do think this is something where we need to make sure that this report does have some traction, because there have been several reports over many years into this very problem, and things have not changed nearly quickly enough. And I think we've written this report, and we need to follow through to make sure it does make a real change for these people in these units.
So I think we're in violent agreement, and I see everybody else around the board nodding. So we need to take away and think about how we do make sure that this is taken seriously and action follows. Right. Anything else on the executive team report anybody wants to raise? In which case, Kirsty, let's move on to, oh, sorry, nearly got there. Mark Saxton.
Sorry, Chairman, I did just want to come back to the designated body annual board report. I did spend some time talking to Nigel Aitchison about it, and I would like to echo the sentiment that, and thanks to Nigel for his hard work. I particularly wanted to ask him whether we were able to capture the challenges of revalidation and registration in the flexible work office. And he assured me and demonstrated to me that we do a lot of work to make sure that working with other organizations to make sure that validation, revalidation and registration for those in the flexible work office is also monitored and controlled. So I thought it was a really good report, and I wanted to echo my thanks to him for that report.
Thanks, Mark, and you were kind enough to copy me in with some of the correspondence you had with Nigel, and it was very reassuring. It gave additional reassurance, so thank you for that. Okay, Kirsty, the performance report.
It's actually Chris who's going to take us through that one today. So, Chris, over to you.
Thanks, Kirsty. Thanks, Peter. So I'll run through, I'll give some headlines from the performance report and then open it out for questions for everyone. So starting with registration timeliness, this is slide 5 in people's packs. Performance of complex applications continues to fluctuate as we had expected, given the low volumes. On average, that's 117.9 days taken to process. Simple applications are taken on average 16.8 days. There's been a focus on reducing the number of applications in the system. We've seen this continue in Q2, which has enabled a 31% reduction in volume since April. On registration representations, so a slight error in the dashboard for this. This is green, not amber, as indicated in the RAG rating. But since April, we have had 90% of notice of proposals have been adopted, which is on target at 90%. In terms of regulatory activity, so slide 7 gives some information about our inspections. It shows that 61% of inspections, for 61% of inspections, the decision to inspect was based on intelligence and information we had, with 53% of those triggered by information of concern, whether it's whistleblowing, safeguarding complaints. It's worth noting the non-risk responses mainly are thematic infection prevention and control inspections in our social care. But more broadly, in terms of regulatory activity, and Chief Inspector's touched on it before. So if we look at so far this year and recently with the commencement of the transitional regulatory approach in October, during Q2, as Kate alluded to, we've delivered over 300 infection prevention control thematic inspections, on track to exceed our target 500 care home IPC inspections by the end of November, and the emergency support framework earlier in the year. If you take all that into account, from 1st of April this year to Tuesday of this week, we have just under 20,000 individual locations who received regulatory activity, which is 42% of active locations. So just going back to Ian's point right at the start, shows how our regulatory remit is still being worked through this year. In terms of safeguarding, slide 8 in the pack talks about alerts and concerns. So 97% of alerts have been processed within 1 day, which is above our target of 95%. Safeguarding concerns have, with mandatory action recorded in timescale, is slightly under our target at 94% against target of 95%. Whistleblowing, slide 9 in people's packs. So since April, we have seen nearly 7,000 whistleblowing inquiries received. This is gradually increasing, and from this point this year compared to last year, we've seen a 57% increase. So we monitor the timescales to record an outcome from these inquiries, and over the last 12 months, it's 5 median days to record these outcomes. few other areas to pull out. One quite important one, another slip up on the dashboard in terms of RAG rating, which is the urgent enforcement. It is actually green, not red. So it's tracking much better than implied. So we aim to serve notice within 3 days. Our target is to do this in 70% of situations. And year to date, we're tracking at 89%. So it is a positive position. In terms of people, there's a couple of more areas from me. People turnover is tracking at 8.2% the last 12 months. We've included information in the cover paper just about employees with less than 2 years service. That's 2.5% currently tracking, and sickness is currently 3.6%, which is within our target of under 5%. And finally, for me on the finance side, so revenue budget is forecast to be 5.9 million unspent at the end of the year. That includes a 1.7 million shortfall on provider income. A capital programme has continued to be tracked very closely. It's forecast to be 3.2 million overspent for the year. That is coming down. We are expecting that to improve in future reporting. So hopefully we'll see that turn around and get back on track. So I'm happy to take any questions on any of that. Open it out for the board.
I'm tempted to ask Chris how you got on when you were caught jumping a red light, saying it was really green, but I won't. Is there anything anybody seriously wants to raise? So a lot of good stuff in here, and a lot of joking apart is really encouraging. I think a lot that we should be very pleased with, and congratulations to everybody that's involved in delivering all of this. Okay. Oh, sorry, Ian, you want to come in? Ian.
Thanks, Peter. I think the point about whistleblowing is an important one, because I think it links the change work that we've been doing with real outcomes, because the work we did on give feedback on care that Chris and Mark's team in particular were focused on to deliver that better way, an easier way for the public to report their experiences of care, meant that when COVID arrived, we were in a very strong position. And as Chris was describing, we've got a 50% increase in whistleblowing and information from the public. That translates into a much stronger evidence base and an intelligence base for colleagues to go out and inspect against or make regulatory judgments against. So I think that it's a good single indicator which demonstrates that connection between our change program and actually action on the ground.
Yeah, I agree. Okay. Kirsty, are you actually going to do this report yourself, or?
I am going to do this one, but I am going to hand over a little bit to Mark as we go through. But I will do most of this one. So thank you. So this is the change update for this quarter. It has been a very busy quarter with a lot of work coming through and out the other end of the delivery pipeline. Just a few quick highlights before I get into the detail. I think this quarter, our Digital Foundations programme has closed out. It was a very challenging programme running to very, very tight timescales, and this one really was a very positive achievement as it finished on time, to budget, with the desired quality, which doesn't happen very often in the world of complex programmes. So just want to say a massive thank you to the team that were involved in that piece of work, because it was a really, really challenging programme. We've also made really good progress on 3 major areas of our focus, which is our transforming our organisation, our regulatory platform, and the work we've been doing on our transitional regulatory approach. As well as that, we've also launched our D&I strategy, which is one of the inclusion. We've launched our inclusion pillar, which is part of our people plan, and we've also carried out some work around our cultural inquiry across the organisation. We've also managed to launch our People and Analytics Data Hub and our Workforce Planning Dashboard, which is now starting to provide managers with really good real-time information about their teams, and really enabling them to sort of have fingertip management information to help them manage to best effect there. I think in terms of work, the programme overall, despite the challenges of COVID-19, which have been significant, we have managed to maintain our focus on our transformation agenda and keep the work moving forward within the programmes. The transitionary regulatory approach, which is, I think we've talked about earlier, is our response to how we are adjusting our regulatory approach to cope with COVID. It is also providing us with an opportunity to test out some new ways of working so that we can use data and insight to really help us have a more proportionate approach to risk and understand where the risks are in providers. We've made really good progress with this piece of work, building on the learnings from the ESF and also from able to utilise the new technology platforms that we've put in place, and we've now rolled this out across all of the directorates over the last quarter, and really starting to look at how we can use this more broadly. We are building on the ESF and have incorporated the key lines of inquiry into this particular version to give us a wider view of risk in a service. We are now looking at how we then take that forward and expanding on that piece of work to give us more opportunities to use this across the wider spectrum of our regulatory activity. The target operating model work, just to recap, is a programme designed to develop our new operating models to support realisation of our new strategy. We have been working closely with the senior leaders in the organisation on this one over the last few months to refine our thinking around our design, and we have now developed a blueprint which sets out our future ways of working, which sets out for describing how we will create. How we will create capability, capacity, systems and processes to support the realisation of our strategy going forwards and also to deliver benefit for service users. We're working with leaders across the organisation to test the thinking and assumptions around the design, and so that we can start to then take this forwards into a more detailed design phase over the coming months. Our regulatory platform work is a real key enabler to our future strategy and future ways of working, when we'll provide that modern interface to drive optimised working practices across the organisation and really help us in terms of being able to drive out really efficient regulatory processes. We have now developed the implementation roadmap for that and are really in terms of the areas of priority, and are just in the process now of standing up 4 teams to deliver work streams concurrently to enable us to realise value from that programme as soon as possible. Our registration transformation programme continues at pace. Our new register with CQC digital service continues to be iterated. We have now produced that end-to-end service, which is in private beta, and users who have used that service are reporting that it's good levels of satisfaction, it's easy to use and saves a considerable amount of time. We're now working through the next iterations of that as we start to scale that product up. We've already mentioned give feedback on care, but what we haven't said is we took that through our GDS assessment. That's our Government Digital Service Assessment. We passed that with flying colours, and I think, again, just to recognise that's the first one of our new digital services that we have taken right through into live running, and to pass our GDS assessment at the first go was a real achievement. So again, I just want to say thank you to all the teams involved in that, because it's been a really good piece of work, and as we've already said, that's now into live running and starting to really provide good data coming forwards in terms of information from users of services. Our quality improvement programme continues to build momentum, and we have made progress along across all areas of our key corporate activities, particularly around improvement with our enforcement processes, our notification process, and our internal legal services. We've also made really good progress in establishing and getting our directorate improvement groups up and running, with quite a lot of projects now coming through from inception right through to delivery on a regular cycle now coming through the directorates. And as well as that, we've also made some really good progress with upskilling our organisation in QI capability, with 25% of our colleagues now taking the bronze award, and we'll continue to see those numbers go up over the coming months, I'm sure. I will come on and talk to people, but I thought I'd just come back and talk to people in a minute. But I think if we just hand over to Mark to just pick up on a few of the areas that I haven't covered.
Great, thanks.
Great, thanks, Kirsty. So it's been a really good quarter of some significant programs coming to a conclusion in the digital space. As you mentioned, our Omni program delivered that technology replacement to our NTSC contact center solution. This has given us a more modern, feature-rich and robust service, but very tight deadlines that we had to deliver this critical replacement. I'm really pleased that team has delivered our core telephony and workforce management solution successfully. That's ensured a real safe continuity of service for the contact center, which was our primary focus. And now we move on to looking at rolling out the enhanced features of that solution over the course of the next year. Again, as you mentioned, our Give Feedback on Care service is now fully live. It's how we encourage members of the public to give their online feedback on provider services, and it's in this now a fully live GDS assessed service, and it's a really key way that we leverage simple and accessible technology to gather that voice of service users. And last month I talked about the last quarterly update. I reported about the Digital Foundations program coming to an end. This is officially closed now, and it's established our foundational infrastructure, the internal capacity and appropriate external partners to deliver a really effective technology service to our colleagues. That includes a new service desk, new security operations centre, modern technology, productivity tools, and a flexible and responsive set of core services that really underpins our future transformation for regulatory and data platforms. So a really significant achievement, and good to enable that to be a stepping stone for moving forward. And in the last quarter, we've had that operational service in live running, and it's been really successful. It's been a stable operational service and been really well received by our colleagues. So having closed a number of programs, we're now forging ahead with some new work. So this is new transformational work. So our regulatory platform has completed its discovery phase, and we're moving ahead with our delivery partner to begin the build phase. This is building out Dynamics 365 to support our regulatory activities, and those number of work streams that we've got running in parallel that Kirsty mentioned range from building the new environment, establishing the core data structures to enable us to deliver the key business functionality around fees, inspection, rating, publishing, registration, our NTSC case management, and the digital experience for our providers and the public, and to do that work all in tandem. We've talked about our transitional monitoring app that's been developed on the Dynamics 365 platform, and work will be ongoing to complete over the course of the next couple of months to subsume that within the regulatory platform, so we have a single place for our regulatory activity from a digital perspective. And then finally, the intelligence-driven enablers work is also now underway in anger. We are working to build a number of use case capabilities using the Microsoft Azure data platform. Over the course of the next 3 months, we'll get an understanding of how we can use this new platform to deliver capabilities like a live visual dashboard for health and social care systems for our regulatory colleagues, generating event-driven insights for our inspectors in real time, and exploring what insights we can drive from social media into service users' experience. So overall, really positive quarter of technology programs coming to a close, and now a focus on our transformational work that really supports our regulatory activity.
Kate, do you want to just update on IRT?
Yes, happy to. party close cultures at next board when we hear the final Glynis Murphy recommendations, and also we are confident that a couple of elements of the programme that were not quite where they needed to be are back on track, and I will be confirming that tomorrow when I chair the next board.
So, do you want to do any questions on that before we move on to people?
Right. There don't seem to be any questions, but I just want to say, I mean, at the risk of sounding like somebody at an Oscars ceremony, I just really want to congratulate everybody that's been involved in the change programme. These are not small projects, and they have been delivered tremendously well, on time and on budget. Those that have been finished, and lots of others still underway. So I just really wanted to say well done to everybody. Unfortunately, that's now opened up a whole lot of questions. So Liz, you were first, and then Mark.
Thanks very much. I had quite a specific question. It's really good to see the developments in give feedback on care, both in terms of the expansion, in terms of how many people are getting in contact with us, and also the app and the improvements in process, etc. Two questions really. The first is that you say in the report that we're getting better quality and more structured information about people's experience, and I'm really interested in this question about, if people give feedback in a sort of quite a discursive way, how we pick out the really key, pertinent, salient points. So I'd really like to understand how we are analysing that. And the second question is, I know people are very keen to know in general terms how their feedback is used, and I wondered what progress we're making on being able to close the loop and give people that feedback. Thanks.
Peter, can I have a go at that? So you're absolutely right. There is an important bit about how we gather the information, and this is what's in the background of this is a months of working with public and public groups to understand how best to structure the information so that people can get it down easily and not put off by a long form, but that they are able to say information which will help us identify which organisation are we talking about and what's the nature of the concern. So there's a whole series of about 3 or 4 months worth of basically a series of sort of alpha trials of different approaches, and what we've got to is an optimal which will give the intelligence colleagues enough information to identify the organisation, which is key to this, and enough information about what has happened. So there's basically a series of structured information which cuts out, if you imagine a sort of a questionnaire which automatically takes out questions as you answer others, so it becomes a series of questions that are pertinent to your issue. That's basically what the team have developed, and they've developed it working directly with a range of people with different digital literacies, so that it gives them a really clear and comprehensive view of this is the organisation, this is the nature of the issue, and therefore this is a type of, is it a whistleblowing actually, is it from a colleague who works in an organisation, is it from a family member, is it something that's very, very serious and it needs to have immediate response. So basically a series of, that's exactly what the alpha and the beta trials have been around, is determining that balance between getting enough information to take the right action and not having the information, as the original form did, to be fair, be overwhelming in terms of what it asked for, that put people off. And one of the key measures of that success is there's now, it's a very, very small drop off. It's like 5 or 10% drop off in terms of people completing the form, whereas before it was near a 70% drop off. So that's, I mean, there's still work to do, and the team would say themselves there's still work to do to develop it further. But that's the piece of work that's helped, I think, push our ability to have a better understanding of what's going on. In terms of your second question about responses, really, really important. I mean, there are a number of ways in which we're looking at this. For some of the work we've done, we're asking inspectors to say how they've used the information. So often they might use it if they're going to do a responsive inspection, or it might tune in some of the work they may do thematically, or it may cause them to have conversations with others. So we're trying to be clearer and clearer about how we're using that information to drive our regulatory action. my ambition with this is that we can be more clear about that in the way we go back to individuals, but also how we describe that on our website, so we can talk about the experiences that people have had from different services. So there's further work to do in that list, definitely, but I think we've got to at least the first stage of being able to be clear with inspectors. It's important that they can say how they use that information. I mean, I think just go back to what I said earlier, what Ian said, the fact that we've seen a significant rise in responsive inspections on the back of what people have said and the back of what Whistleblowing said, I think is testament to how quickly we are using that information to drive our inspection activity at this time.
Great, thanks, Chris. So Mark, then Paul, and then Jora. Mark.
Thanks, Chairman. I just wanted to congratulate Kirsty on the QI capability development in CQC. I mean, really, it's a whole sort of QI community with its own database that's being built. And I think it's really a fantastic piece of work. At the conference, I went to one of the QI bronze training sessions, and it really was a very active session. And I just wonder whether this sort of online and group approach to learning for bronze training, which I think was successful at the conference and is continuing to be rolled out, whether that can be applied in other areas of the learning programs that we have within the Academy.
Thanks, Mark. So we have, obviously bronze has been online, and we've had to, our silver program was originally going to be face-to-face, and we've moved that to an online environment as well, and that's going really, really well. Same for our gold. I think all of our academy training that we had normally delivered face-to-face, the team have done an amazing job of moving everything to being online. So we have gone from that a blended approach of some online training, some face-to-face, to everything being online. It's working really well. I mean, there's been quite a huge amount of work actually to enable us to do that, but we haven't. Our training is still going ahead. We're still getting lots of people through, but we're just doing it in a different way and really adapted quickly, I think would be the best way of describing that.
Yeah, thank you.
Thanks, Kirsty. Paul.
Thanks, Peter. And it may be that Jora's coming in on the same sort of topic, but the program that we've heard the update on today is really quite incredible in terms of where we've come from and where we now are at in terms of our capabilities to execute a program of this size. I just wanted, and congratulations to the team, all the team, on doing that. I think it is a real testimony to standing up and changing the organisation in many ways. I think the one thing I just wanted to highlight and perhaps ask about is the where we are in this programme, which does stretch out before us to some extent. But it's not almost over at this stage. There's a lot still to come, and there is still a lot of risk around, which I think is being managed pretty well. But nevertheless, there is still a lot of risk in this, and it might be worth just reflecting on that before, as well as congratulating yourself on all the achievements as well, because the programme does touch almost all parts of the organisation, and will continue to do so, which is great, but is also a little scary from time to time. I don't know if Jora wanted to say something along the same lines, but
yeah, let's bring Jora in before you respond, Kirsty. Jora.
Yeah, I had two questions. One following up from Paul to Kirsty, but one sort of more tactical question for Mark. I'll go with the first one so Kirsty can respond. Yeah, I think it's tied into what Paul was just saying. I mean, it's magnificent, the scale and the ambition of what the team are attempting to achieve. And I think it's also demonstrated that the successes in the projects that have been delivered so far, and the tiny projects, because of the responses we had to make to COVID along the way that we sort of sometimes forget about, but have had quite an impact in terms of providers and also people receiving care. Yes, Kirsty, we have individual projects and project risks, but then we look at them holistically at the portfolio level, and that could be anything from resource management to change management, and with so much going on, is there a risk that, you know, if you get one or two projects that sort of don't quite go the way you want, it starts impacting the rest of the portfolio, or is the portfolio sort of protected in a way and independent from sort of individual project risks?
Okay, thanks. If I answer, I'll pull all those together in terms of my response to both Paul and to Jura. So I think we're not even halfway through this complex program, to be perfectly honest. And I think at the start we broke the activity into three areas: the sort of underpinning capability and enabling capability that we needed to build, particularly in some of the digital programs, a focus on improving what we do today, and then also a chunk of work focused on the future. We've made some really good progress with that underpinning piece, particularly things like the Digital Foundations program and getting the reg platform up and starting to get that up and running. But again, we're still I wouldn't say in the foothills, but we're out of the woods and heading for the top of the mountain with that piece of work, but still quite a lot to do in there. I think the key piece, if you think about the future piece, has been our new strategy and then the target operating model work to support that strategy, to ensure that we have the skills, capabilities, processes, and capacity to deliver what we need to do to make the strategy come to life in the future. That has, I suppose, if you like, is the target operating model work. I would call it the spine now that sits across all of the transformation. Now we've started to really get to grips with what that looks like, and then also the strategy. What we're now in the process of doing is starting to map those. So we're taking our sort of regulatory process end to end, looking at that in terms of the strategy, and then looking down at where all the programs sit to make sure we really understand what the interdependencies are across the portfolio, but also if we've got any gaps, and that then enables us to make an assessment of is the portfolio constituted in the right way, or do we need to add things, stop things, slow things down. As part of that process now, as some of these bigger projects start to mature with their detailed delivery plans, we can now start to look at where those interdependencies sit. So to your point, Jura, we now have that visibility when it's getting better, so day by day, of the portfolio and the interdependencies across the portfolio, so that we can understand if one project slips that has a dependency elsewhere, what does that then mean for the portfolio risk as a whole. And we're now, I think, by the end of the next quarter, we would have completed that work to really have that dynamic visibility over the portfolio as a whole, so we can start to play tunes on it and also start to do some scenario planning about, well, what happens if that slips? What does that mean for that project? What does that mean in terms of resources, benefits realization, and things like that? So I think it's something we will be sharing through our ACGC subcommittee in the new year, so we can really have a look and you can understand how we're managing those risks. So I think in terms of the work we've got to do, we've certainly got another couple of years at this, if not a bit longer, in terms of starting to realise our target operating model piece. And then obviously it then becomes where do we want to go next in terms of the opportunities around driving out our digital agenda, because the digital piece is moving at pace, and what we have done now, if we want to really keep current in terms of being able to use our data in new and innovative ways, we're always going to have to keep some degree of investment going, I suspect, as an organisation in this area.
Thanks, Kirsty. Paul, did you want to come back, or has that answered your question?
That's answered my question. I think we've seen that it's a fantastic thing to be done, but we're quite realistic about the challenges ahead, which is, I think, the important thing to note.
Perfect, thank you. So, Jura, I don't know if you want to come back on anything Kirsty said, but I know you've also got a question for Mark you want to raise.
Yeah, no, thanks, Kirsty. Mark, it's quite a tactical question, but I was just thinking about the feedback app. I was just going to ask, has it been designed with accessibility in mind? So whoever's responding, it's designed in such a way.
Yes, absolutely. And in fact, one of the major pieces of the GDS framework is accessibility, and we wouldn't have passed with flying colours if we didn't complete that. And we use the standard GDS templates which are designed with accessibility in mind. So yes, absolutely.
Thank you.
Good. Paul, you might like to put your hand down, otherwise I won't realise next time you want to speak.
Shall I do the people bits now then, if that's
Yes,
okay?
please, Kirsty. Yep.
So thank you. So alongside our ambitious transformation agenda, we've also got an ambitious agenda around our people strategy. This is designed to support the delivery of our transformation agenda and basically build the capability and culture we need in our organisation, not just now, but also for the future. In the last quarter, we've continued to work closely with the team delivering the target operating model work, and have to support that, we've completed an organisational-wide cultural audit to baseline our current culture. This has involved colleagues from across the organisation talking about what it feels like to work at CQC. This has been a really important piece of work for us, and it now gives us a really solid baseline to understand the culture, but also understand where we might want to look in terms of focusing our efforts on in the future to ensure that we both maintain those bits which are fantastically and supportive for us now and in the future, but actually where we might want to pay some special attention to some of the cultural aspects that we might need to work with to enable us to really move forwards into the future. We've also launched our success profiles. This again has been a really collaborative piece of work where we have involved colleagues from across the organisation at all levels and in all roles to really start to describe what our behaviours look like when we are at our best. This is now going to help us provide a framework for a new and revamped performance management process, which we're planning to go live with in December, and has been and is really good. It'll help us as well with all sorts of things like around recruitment and things. We're really clear about sort of what the standards are we want to see at various grades. We've also, around our D&I strategy, and I mentioned it earlier, we have really focused in on our inclusion pillar over the last quarter, and I'm really excited to say that we've launched our reverse mentoring program, and this is part of our inclusive leadership strategy. And what this is where we're matching senior leaders from across the organisation with junior Black and ethnic minority colleagues to facilitate open and honest conversations about their lived experiences and how we can drive a more inclusive culture in CQC. I have now got my mentor, and I'm really looking forward to having those conversations over the coming months. I think it's going to be incredibly powerful. We have also just run our latest Pulse survey. This is a survey that we do on a quarterly basis to gather employee insight into their experiences at working from CQC, and we're just in the process of analysing that information. This one focused on wellbeing issues and how people experience change. We've also continued to review our policies, bringing those up to date, and we've made good progress in going through all those, and we're on track to complete those shortly. So I think that's most of what I wanted to say around the people piece, and happy to take questions.
So I too am looking forward to meeting my mentor next week. I hope she's looking forward to meeting me. I don't know. I'll find out.
I'm sure she is.
Mark, you're on mute, Mark.
Yeah. Thank you, Chairman. Kirsty, thanks very much for the people report. It's really great to see the people plan. It's a really vibrant part of the organisation and really delivering some value. The success profiles were launched at the very successful conference. For again, congratulations for that. But I just wondered if there's any sort of immediate feedback on the reception of the profiles from that launch. Because, of course, that's going to very much influence this newly revamped performance management process. So what was the initial response to the success profiles is my question.
I don't have an answer to you there for that. I can ask Jill and come back to you outside of the board and just let you know what the feedback has been on that.
Okay, thank you.
Okay, anything else? Otherwise, let's move on to the Insight report, please. Thank you, Kirsty.
Okay, so this report, again, we've done this quite a few times today. This is a testament to the work of intelligence, the chief inspectors teams and engagement to give us a current and clear view of the main issues that CQC is concerned about at the moment. This particular issue, issue 5, talks to two issues in particular: the infection prevention control inspections and also the COVID Insight survey that we commissioned earlier this year. So what the report seeks to do is to build on the learning of good practice about infection prevention control that we discussed in the last issue, but also present some of the findings of the survey to understand people's experience of inpatient care, particularly during that sort of first wave between April and May of the pandemic. We want these Insight reports to help everyone involved in health and care to work together, to learn from what's happened in the pandemic, to share and reflect on what's gone well, to understand and learn from what hasn't, and to help health and care systems prepare better for the future. So in terms of the infection prevention control in care homes, which is could be subtitled "Delivering on the 8 Ticks," as that Kate mentioned earlier, we go through each of the areas that we look at in terms of the performance. So access to visitors, shielding, safe admissions, effective use of PPE, testing of staff, layout of space and hygiene practices, staff training and IPC policy. And it gives a view on where we think some of the what's working really well, both from organisations that are good and outstanding, but also organisations where we've got additional concerns. The same process is also used for the work we've done on the designation scheme. There are two issues particularly I just want to highlight to the board. One is around there's really good practice around testing the staff of people who use services. So good services had an enthusiasm for well-managed approaches to testing and demonstrating they go the extra mile to achieve this by encouraging people who receive care to take tests, respecting their rights, but also working with them. And I think there's a really strong piece of learning there about what's working well, and also some general points about effective use of PPE, and again promoting a culture of responsibility, engaging staff well so that they use the information, and obviously providing the right training and support. So we'll continue to do this work, and we'll alongside the monthly report that we give to this report. It goes out generally, but it goes particularly to colleagues at DHSC, NHSC, ADAS and the LGA. We want to give people a sense of what's happening on a week-by-week basis, so we'll aim to update some of this information on IPC more on a week-by-week basis as well. Now, moving to the experience of the hospital inpatients survey during the pandemic, we wanted to get a sense of people's experience of care during the first wave of the pandemic. The results are, as often with these things, are a mixed bag. We did about 10,000. We had about 10,000 surveys from across the country. It's fair to say that it shows that most people were positive about the care and treatment they received in hospital during the first wave of the pandemic. But those diagnosed with COVID had a poorer experience of general care, particularly the issues of concern related to discharge from hospital and knowing what would happen next in terms of their care pathway. It's also interesting to note that the people who have people with dementia or Alzheimer's or have a mental health, a learning disability or autism also experienced poorer care as well. As I say, the survey captured everything from the quality of information and the interactions with staff, how well they were able to communicate with the staff were able to communicate with friends and family, the cleanliness of the hospital environment and the discharge arrangements. And there was a number of recommendations in the reports around what we thought worked well, from everything from how patients felt safe, how they had good conversations or poorer conversations, and how they understood what was being said to them in terms of their treatment and leaving hospital. We think that all of this information is useful not only to organisations in hospitals providing care, but also for the relationship between hospitals and adult social care. And I think the work we're doing on the designation scheme is part of that. But I think this is useful information as well to show It's not just about the physical environment, it's about the relationships and the conversations that happen at that point of discharge, so that people absolutely understand what their next, what their treatment looks like as they leave hospital. It's fair to say that there are some areas of really good practice, but also some areas where we will continue and want to do some further work, particularly around patients with autism, dementia and Alzheimer's. And we're talking to public groups about their experience of care. We'll continue to monitor that and report on it in future updates and insight reports. Just to finish off on the Insight Report, those are two areas, and there are a few others. Our aim with this is always to provide a current view of what's happening, and increasingly we want to use the information we gather from the regional groups to form a better regional picture of how things are happening, what is happening in each of the areas of England that we regulate. So we'll try to provide a more of a regional breakdown, as well as some of these national themes that we discuss in this report. Peter, I'm very happy to take questions on the content of the report from there.
Thanks, Chris. Liz.
Thanks very much. I mean, I think it's great to be able to put this into the public domain now. It just seems so timely in terms of, some of the learning from the first wave and what that could mean for things like discharge planning now of people who are going into hospital with COVID, for example. I suppose I just wondered, there's a number of areas there's good practice highlighted here, and there's also areas of concern. And I'm thinking about, we've got some statistics in here on deaths of people with learning disabilities and also deaths of people detained under the Mental Health Act. But we've also got that survey data showing, as you said, that, for example, people with dementia and some other groups are more likely to be dissatisfied with things like the information they've had and how well they understand what's going on. Are we planning to draw on this in our own ongoing regulatory work, I suppose, is my question. So, if there are particular concerns, let's take people with dementia and whether people are getting the information they need, whether they understand, whether discharge planning is being done. Are we actually building that in, using this as a lens in our own kind of ongoing regulatory activity? Because it just seems so important in terms of some of these disproportionate impacts that the pandemic is having on some groups of people.
Ted's got his hand up, so you may want to answer first. Do you want to go first, Ted? With that?
Well, I think you're right, Liz, and the findings here are really interesting. I mean, it's important to say that a lot of people are very satisfied with their care. We need to acknowledge that. But having said that, there are some groups that are particularly dissatisfied, particularly with the discharge arrangements and the communication that Chris has been talking about. Interesting, that reflects what we see in our national inpatient survey anyway. And you may remember the last national inpatient survey before COVID showed very similar findings, that those people with Alzheimer's felt less satisfied with the discharge arrangements and the information. So I think there's a more general lesson here that we need to take, not just on COVID, but into our wider regulation. Absolutely. And I think discharge, but also how the hospital operates with the rest of the system, how the hospital hands over care, that continuity of care and that pathway of care is absolutely critical to the quality of care. And I think that's something that shines through here very, very, very well. Interestingly, the majority of people in hospital during the COVID pandemic felt safe from cross-infection, which is really good. But the one thing they said they were worried about was social distancing in the hospital. And actually, that is the one thing that we have been mostly worried about. That often the hospitals are busy places under pressure, and maintaining things like social distancing can be a real challenge. But having said that, it is important that staff are as meticulous as possible about that. And certainly that's something we've emphasised in our work with trusts on infection control over the last month or two.
So, Chris or Ted, I mean, this is a sort of publicly available report, so obviously anybody can read it. But are we confident that it's getting to the right people in trust so that they can then respond? Because as you say, Ted, this is actually not new, is it?
Sorry, Peter.
No, go on.
So it's a really good point. So I think that just to say how we use this report nationally and locally. So nationally, it's important. So we share this information with the Department of Health and Social Care and with the Minister, and we use it as part of the briefing, the regular update briefing that we provide to the ministers, so that they are aware of our concerns and our issues. We also use this to brief. So today, as this report goes out, we are briefing provider representative organisations, public representative organisations, and national organisations on the detail of the content. We've already had a really good conversation with NHS England about what some of the content is shared as being. As Ted said, some of these things are known, but those are important to keep front of mind, I think, when organisations are thinking about their arrangements for organisations. And I think it's important that we can keep that focus on that relationship between what a hospital does and what happens when people leave. And I think it was particularly important in the first wave. It will be particularly important in the second. So we use it as a way to brief. This is a sort of opportunity for us to brief over the next few days a range of stakeholders to make sure everybody understands the implications of it. We've been so far. The conversations had just prior to publication be very positive about people's understanding of what it says, and people using this as a vehicle for having good conversations in their own organisation, which I think is part of the trigger for this. It triggers better conversations and better action in local organisations. So I don't know if you want to say more.
No, well, we write to Trust to draw to their attention to this survey, and we will communicate with them about it, because I think there are important lessons here, and there is a lot that they have learnt already from the first wave of COVID, and I think this is extra information for them to take forward going. So I think it is important that we do communicate with them effectively on it.
Thank you both. Any other questions or comments? Chris, it's a great report.
Great, thank you. Well, it's a good team effort.
Of course. I wasn't suggesting you'd written a great report. I was just saying it was a great report. No, seriously, great. It is a great report, and thanks to you and to the team. Okay, are we happy to move on? So we're a bit ahead of time. Kirsty, I don't know whether Jill's with us yet, but are we able to go to the Pulse survey? Or
just chase her up now.
So, Liz, do you want to, while we're waiting for Jill, do you want to do the report from the RGC?
Yeah, sure, Peter. So we had a good Regulatory Governance Committee meeting yesterday. We looked at 3 substantive items. The first 2 were both pilots developed in the context of COVID for assessing services without needing to cross the threshold. So one was in the context of domiciliary care, and experts by experience are talking to, if anything, probably more people using the services than would be done through a regular inspection process. And also the service providers are sharing data with us. And we're awaiting evaluation of it, but there's some encouraging early signs that this methodology may help reduce some of the bureaucracy and the time involved for people. But of course, it's really important to go in physically wherever is needed. But some of the aspects of this could be used longer term alongside physical inspections and crossing the threshold when that's required. So that was an encouraging, and we looked at the methodology and the learning so far. The second one was related to primary care, and again this involved sharing of data by GP practices, Again, there was some promising indication that we could get a potentially even stronger analysis of some of the themes and some of the issues that were going on for patients in primary care through an approach to analysis of records and things like that that are being piloted. But again, we're awaiting evaluation. So that was promising, and in both cases, potentially some methodologies that could be used longer term alongside our physical inspections. The third item that we discussed was the review that we've been commissioned to do by the Secretary of State into do not attempt CPR, and Rosie's already talked about that this morning. But essentially, we were able to take a detailed look at the methodology, the engagement that's happened so far. I think there's been good engagement and some really key themes that have come out of that engagement. We looked at the methodology, including the decisions on which parts of the country we're focusing on, the balance between national data and deep dives to give us a view into both systems and the personal experience, and the way that discrimination or lack of sensitivity can operate. But as Rosie said earlier, also really wanting to highlight good practice, which good practice is hugely important to people who are going through that advanced planning process. And this is a sort of relatively short-term piece of work, so we'll be expecting an interim report fairly soon, and then a final report in February, I believe. So we talked quite a bit about what can and can't be done within those parameters, but we thought that we were assured that the methodology would give us a good and useful report, albeit that we couldn't cover absolutely everything given the timescale.
It was a very good meeting, Liz, I thought last night. Thank you. So, Robert, you have your hand up.
Yes, and firstly, I apologise for not being here in the earlier part of the meeting, or indeed at Liz's meeting yesterday, but I just thought I ought to register that I've been asked to be the board member, sort of giving some degree of oversight to the DNAR project, and I was briefed this morning about it. And I just wanted to say that the methodology looks extraordinarily thorough, given the timescale in which this has got to be done, and it's a very important piece of work. The world is full of guidance about how to do this properly, and I think the challenge is undoubtedly has been how to implement that guidance in times of extreme pressure. And I think it is vital that we listen to the people who have experienced this, and I think this research will do that very well indeed.
Thanks, Robert. You were actually thanked in your absence this morning for for agreeing to do this, so thank you. Okay, so if Jill's not with us, I think we've got two choices. We can either have a break now for lunch and then resume at the sort of allotted time with Jill, or Ian, we can just go ahead without Jill. I mean, we've all read the report. We can do whichever you would prefer.
I can't raise Jill or Kieran. I've been trying to get hold of them, so I don't know where they've got to. So.
Well, they're in fairness to both of them, we are uncharacteristically early.
Yeah.
It's never happened before, so well, at least not very often. So look, we've got two choices. We can either adjourn, have lunch, come back at the proper time and just carry on, or we can take the pulse survey without them.
I think my preference would be to carry on. I'm conscious that we've got technical colleagues obviously recording this meeting, and to stop and then restart in the public meeting feels a bit unnecessary.
Okay.
So I think between us we can probably do this justice. So do you want me to kick it off, Peter? Would that make sense?
That would make great sense. Yeah.
So I mean, essentially, what you've got in front of you is our pulse survey. Board members will recall we did a pulse survey early on in the COVID period, and we've done this second one. And what we wanted to do was to focus this on well-being. When we did the survey, this was prior to the current lockdown period, and it reflected, I think, how people felt over having been in lockdown for a period of months, and we wanted to explore with colleagues how they were feeling, and also whether we've been effective in communicating some of the key messages around change. We talked a lot in this meeting around a comprehensive and sophisticated change program, but we've been doing a lot of communication activity and a lot of engagement activity on that change program during the COVID period. And I think that, one of the questions we were seeking to answer was, is that sensible and realistic to be doing that in a remote way, particularly when individuals were under a lot of pressure, both personally and at work. I think many colleagues have talked about people going out and working in extreme circumstances in environments which have got COVID present and so forth. And at the same time, they're being given messages around a change program and things that are different and new and so forth. So I think a number of kind of moving parts, if you will, over the summer. We wanted to test out the degree to which those moving parts were meshing together, and the fact and whether this was something which was working well. And what we found, generally speaking, was that there were some unsurprising messages. I think one of the messages was that people feel okay, but there were variations between teams, and but what we did find was people were hearing some of the change messages. I'll hand over to Kieran in a second because I've just noticed Kieran's just joined. But I think the other thing that I felt was particularly important was looking at the number of people who would recommend CQC as an employer. I think there's been an important uptick in that since this time last year, but a slight reduction since the beginning of since May, when we ran the last survey. So there's an interesting dynamic there that says, generally speaking, people are more engaged, and they're more engaged with the change programs. But I'm not quite sure how to justify, if you will, the change between May and now in terms of people's willingness to recommend us as an employer. The differences are not enormous, but they are something which are probably significant and need a bit more work. I know Kieran's just joined us, so can I ask Kieran just to pick up on her thoughts on the survey? Kieran.
Thanks, Ian. So yeah, just to kind of give a little bit of a background around the survey this time. So this is our second pulse survey of 2020, and this time we kind of focused this survey really around questions around change, as Ian was talking about, to really get feedback around the conversations that have been happening around the organisation around strategy and transformation. We also put in a couple of questions around performance and recognition, really to start to get a bit of a kind of baseline bit of feedback in advance of kind of the forthcoming work that we've got around these two areas, particularly around success profiles. And we also continue to ask the kind of regular question around well-being, to keep getting a sense of how people are feeling based on the current kind of pandemic and current work environment. So it was a really useful question in our May pulse survey, so it's something that we continue to do and something that we will look to continue to do for kind of longer term pulse surveys. Had a really positive response rate for this survey, 80%, which is our highest so far, and it reinforces that the kind of pulse survey format is working really well for us as an organisation. We're continuing to get kind of really good feedback and reliable data from the survey. So in terms of the results, as Ian has, I think, already alluded to, we saw some positive changes and positive responses in relation to some of the change questions that we've asked previously in our last kind of main survey in November 2019, and seeing some really positive increases in how people's kind of understanding of why change is happening and feeling kind of good around the change that is happening within the organisation. And we've seen those positive increases, which I think is really important for us to hold on to and to note that our approach to change, our approach to engagement around change has been landing well within the organisation. I think there's still some way to go for us to kind of help people feel connected in the feedback loop So understanding how their views are contributing to change, and how their views are being heard, and how that feedback loop is kind of reinforced within the organisation, and also feeling positive around the kind of implementation of change. And that's always been something that we've kind of generally scored lower, and even though that has increased slightly, that's something that we want to be able to continue to work on. And as we go through the programme of changes over the next kind of months and years, I think that's something for us to take note of and to really focus on. And so these results are kind of being shared wider across the organisation at team level and directorate level, and teams are having conversations about the results for what they mean within their teams, and particularly around well-being. So that's something that we encouraged last time and worked really well, is for local teams and directorates to have conversations around what their wellbeing results are telling them as an organisation overall. People are generally feeling okay, but there's lots of things that we know that are impacting how people are feeling day to day. And so those local conversations are really important to understand kind of what's impacting wellbeing. And just to pick up, I think that Ian mentioned around the recommend question and how we've seen that kind of change over the last few surveys. So we have seen it go down from what was a really significant increase in May. So it was quite unprecedented for us to see that kind of increase in May from our main survey, and we've seen it now drop down a little bit, but it's still higher than our kind of November benchmark from the main survey in 2019. And it probably reflects something around how pulse surveys give us kind of dynamic feedback. Really, they are kind of telling us a bit of feedback on how people are feeling in a point in time, and it shows us that can change over a period of time. But the really positive thing is that it is still showing us improvement from 2019, and from previous years when we measured this kind of only once a year. That's been a really difficult measure to kind of shift more than 1 or 2%. So I think it is really positive to show that the work that we have been doing is increasing how people are feeling about the organisation. But it's important to note that we will, as we do the pulse survey, it does show a different, it can show differences based on kind of what's going on at that point in time. I hope that's okay for a bit of a summary, and then happy to open up for any questions or comments.
So, Kieran, thank you very much. And Jill's now with us, and my apologies to both of you that we are. No, it's my fallen chairmanship and actually managing to be ahead of schedule for once. It's taken everybody by surprise. I was just sort of reflecting, Ian, that if you did a pulse survey of the whole country at work, I think you'd find there's been quite a downshift in how people are feeling, and it probably coincided with the time we were actually doing the pulse survey. A combination of shorter days, darker nights, lockdown, all of that restrictions. So I think our survey needs to be seen a little bit in that broader context. And it's a pretty good survey results anyway, but I think just put it into that context a bit. And Kieran, you're right. I mean, the great thing is by doing frequent pulse surveys, we can pick up changing moods. So we'll see what happens. So let me go, Robert, then Ted, and then Mark. Robert.
Thank you, Peter, and thank you, Kieran, for this survey and your presentation of it. A lot of positives there. What struck me was firstly how important people think that the regular calls to them, as if I've interpreted correctly, are, which is all about real communication, as a human to human communication, as opposed to everything being in writing, and that's fantastic. And I think that reflects through to the acceptance that people are having regular conversations with the managers. But it strikes me there's just a bit of a incongruity or dissonance between that figure and the still positive figure about whether people's views they can contribute their views about decisions made that affect them. And I wonder whether that's a matter of perception, or is it something to do with the type of conversations managers have when they do their regular calls, or a bit of both? Because it strikes me that is an area where, positive though this is, there could be room for improvement.
I don't think anybody wants to answer that, Robert.
Oh no, sorry,
Well,
I was just trying to come off mute, but
Peter, I can have a go at that. I think that's an interesting point, Robert, because I mean I do weekly call. I do a couple of weekly calls each week, and I know a number of non-execs have joined me on those calls, and I think they are important, and I think they do give that authenticity. Although, you know, I must admit I wasn't completely convinced when we started doing them, in the sense I'm a man of a certain age and I've grown up in an environment where every management course I've ever been on says go and look people in the eye and have face-to-face conversations with them, and to therefore not be able to do that and be forced into sort of, if you like, mass broadcast type communications felt like the wrong thing to do in my bones. Although I think I was probably wrong. I think that said, we need to recognise as we come out of COVID to be able to do both things at the same time, and I'm absolutely committed to the cause. One of the things that does strike me though is that we have a chat function on the call, and if I just use those calls as an example, and other colleagues will have similar experiences, is people will often write something in the chat and expect me to agree with it. And I will, and sometimes I will, and sometimes I'll be, sometimes it'll be an intriguing alternative perspective, and it will genuinely change my mind or other people's minds on how we do something. And other times I just don't agree with it. It's just not something that I think is right. It's not something I think is right for the organisation. And sometimes people feel they've said it and I should just agree with it all of the time. And I think that is a bit of a challenge. When you invite a conversation, if you don't agree with all aspects of the conversation, then it's seen as you somehow not listening. And actually, it's not that I'm not listening. It's just that sometimes I don't agree, and that feels like a level of organisational maturity we need to get to. I think where we can have these sort of robust agreements and disagreements in equal measure. And I think in part that may reflect that. But as you're absolutely right, though, these are the sorts of things, these are the conversations we as leaders need to have and reflect, actually, are we doing absolutely everything we can to reflect back to people that their voices have been heard? And when they have been heard, make sure people understand they've been heard, because sometimes people say things and we don't acknowledge it in a way that makes sense to them. So absolutely. Thanks, Peter.
No, thank you, Ian. Ted.
Yeah, a couple points from me. First of all, I think that we made a really good decision when we decided to go for pulse surveys. We didn't see the pandemic coming, but actually, if we had not had these pulse surveys during the pandemic, we'd have much less well understanding of how our staff are responding to it. So I think it was a good decision, and I think as things go forward through the change program, etc., these pulse surveys are going to be really important for us to understand how our staff are coping with things. And one of the interesting things about this survey is staff in very high numbers say they understand why change is necessary, but the actual response to the change and how we're managing change and their ability to influence change is much lower. And I suppose the message is there is that we need to talk to people more in ways that they can understand what we're doing as much as why we're doing it. And I think that's a bit of a challenge going forward. I think one of the most important figures for me is the response rate, which is very high. And that, I think, is a real strong measure of the engagement of our staff through difficult times, which I think is something this is really valuable.
Thank you, Ted. Mark.
Thanks, Chairman, and Kieran and Jill. Thanks very much for producing this report today. I just wanted to comment also on as Ted said, the 80% participation, really terrific. Can I just focus on two points coming out of the survey or the survey process? Around well-being, it's quite interesting looking at the impact on well-being. We're hearing workload quite strongly, and you hear that also just sort of general noise around the organisation. And then the pandemic is the second sort of impact on well-being. I just wonder, are we going to share this report and perhaps encourage our Speak Up Guardians to be aware of this report and these concerns, and to be able to effectively respond to that? I mean, obviously we have our employee assistance program as well in terms of workload and well-being. And we have one-to-one manager-employee meetings. But I just do think perhaps the Speak Up Guardian has a role to play here to help people when they are struggling with their workload. if the situation isn't being effectively resolved between the employee and their manager. So there's just a question there. In terms of future surveys, I think, Ted, you're absolutely right about these pulse surveys being, really important for us in this environment. But I do think, I'll go back to it because I put it out there, I think that we needed to do another full survey between 18 and 19. I think that was important to establish that benchmark and the trends over that period. I think the proposal here to not do another full survey until 2021, I think that's absolutely right, but to continue doing the pulse surveys and getting this feedback and learning from it and continuing to listen and respond to what our people are telling us, that's the key message coming out from the pulse surveys. And thank you very much indeed for supplying the data and allowing us to discuss it this way.
Thanks, Mark. Let me take Liz and Chris, and then we'll come back, Kieran and Jill, if there's anything you want to say. So, Liz.
Actually, I think Mark covered what I was going to ask about, so go straight on to Chris.
Chris.
Okay, just a couple of things for me. I think just in terms of, we shouldn't be complacent about the results, but I think they are good. I just want to give some background as to what I think drives some of this behaviour. There's three things that I think that have been important in the way we've engaged colleagues. One is in a sense of providing meaning to and linking to different activities that might appear disparate. So the conversations around the strategy, the conversations around what we're doing now, and the conversations about what we might do in TOO. The really important bit about linking those conversations so that people understand the journey and not just a series of what might appear to be slightly different things have been really important. Giving leaders confidence to act as leaders in those conversations is and remains critical. So the way we engaged the SLT 30 cohort, but also the wider management team, and as Ian said, he's held, and we all hold conversations with both the SLT 30 group and the wider leadership group. It's been really important to make sure that they feel empowered and understanding of what the messages are, and also feel they can share in the journey about what's been provided. And the final part is about the feedback, so how we use the feedback and how we understand the feedback and use it in our conversations around the strategy development and around TOO. And finally, just in the spirit of there's lots of work that goes in behind this right across the teams. I don't want to pull individual teams out, but I'm going to. So just to say that the work that the TOO team, working with Holly's team and the internal engagement team, have done to make those links across have been really, really important. There's many more people involved in this, but I just think there's so much work going on to try and make it meaningful and real to people both internally and externally. That I just wanted to call that out. Thanks, Peter.
Thank you, Chris. Chris Usher, I think you've got your hand up.
Yeah, thanks, Peter. I was just going to say, in our director, or my director, we go one step further and do a monthly wellbeing survey, and that just shows the value of having comments, because it allows a trend to appear. But to really get under the skin of what's driving that trend, you really need that comment to enable you to home in on that. I think questions like, I believe that changes are effectively implemented in CQC is a prime example, because that will mean so many different things to different people. What do you mean by change? So there's some areas you almost need to do a bit of a deep dive into what's the thinking behind that and where do some of these questions originate from before we try and answer or put in place a resolution to it.
Thanks, Chris. Kieran, do you want to?
Yeah, thank you, Peter. So Mark, just to pick up your question really around the well-being side, so definitely kind of noting those reasons and those kind of the main reasons that are impacting how people are feeling, and those reasons might be different when we take it down to kind of directorate and team level. So one of the key first things is that we're really focusing on using that question as a kind of a prompt for dialogue and conversation at local levels, because I think that will really drive an understanding of what's impacting wellbeing for different teams at different times. We definitely share these results with kind of wider stakeholders, whether that's our network, Speak Up Guardian, so that they can see the overall results as well, and particularly as part of any deeper analysis that we do to find out any hotspots or any areas that we particularly want to focus on. And through that demographic and kind of more detailed directorate analysis, we will pull out any areas where we think that there are any areas of concern. The other thing that we did off the back of the initial May pulse survey, where we first started asking this kind of detailed question around wellbeing, is to share with leaders and with individuals when we share the results out, is details around the support that's available for individual and team wellbeing, and to support managers in their role for supporting teams around their wellbeing and mental health. So that kind of continues, and we've got lots of resources available that we continue to kind of promote and make available to people to support the results and those conversations that are happening. Just to pick up in terms of the kind of future rhythm, absolutely being able to keep a kind of 2-yearly baseline is really important, so that we continue to be able to ask a kind of long and detailed survey, and gives us a good baseline of metrics and measures. But the pulse surveys and doing pulse surveys in different ways allows us to kind of really capture the mood of things. And just Chris, I should pick up a little bit on the point around comment data being really valuable, and getting that right balance between kind of single metrics and understanding the detail that sits behind it. It's also about using sometimes the pulse survey to spark some further conversations. So we might want to do kind of follow-up conversations or workshops, particularly around change, and how do we kind of shift the internal dialogue around managing change being a positive thing rather than a negative thing within the organisation. So doing some kind of follow-up workshops across the organisation is also something that we're looking to do.
Kieran, thank you very much. Thank you for the survey, and thank you for coming today. And my apologies again for catching everybody out by not running to time.
May I just add, Peter, sort of just by way of sort of just bringing this back into the sort of overarching sort of context, is actually, and I think it goes to a number of comments that have been made, is actually this is part of the work that we're doing across the whole people plan, sits firmly within the strand, which is employee voice and employee insight. So actually it sits with data that we gather from the conversations we have with the trade unions, with the networks, with the staff forum, as well as other data that we have about our workforce, comes together in a sort of more complex, dynamic picture. And the only other thing I would say, I think probably to Mark's point about the Speak Up Guardians and actually that broader sense of, are people aware of this? We have, and the workload point particularly, I have weekly conversations with our people leads, who are our sort of our director DCI representatives embedded within all of the business areas, and we are regularly talking about workload, resilience, and well-being as part of that weekly conversation. So it's live on a number of people's agendas. Thanks.
Okay, thank you, Jill, very much. Is there any other business for the board? So that ends the meeting, although there's a couple of questions from the public. Jill, will you just stay with us? Because we need to think about the timetable for this afternoon, and since you've got a star role, it's quite important for you to stay with us. But let's just deal with the two questions from the public. In fact, they're both from Robin Pike. The first question is, how can CQC support hospitals in their need to administer infection control measures whilst maintaining outpatient services? Ted.
Thank you. It's an important point Robin has made. Just to reiterate what I said a bit earlier on in the meeting, hospitals are working very hard to protect non-COVID services during the second peak of the COVID pandemic, and I know they're putting a lot of effort in to do that in a way that is safe and protects people from infection. Just to remind the board, we contacted all NHS trusts using an IPC assurance tool that was built on from the ESF framework earlier on in the year, and we made sure that we discussed with them what assurance they had around infection control, including infection control in outpatients. And so where we found that they needed help and support we put them in contact with that support, often from NHS Improvement, who had a central team supporting that. So we've given a lot of support to trusts to make sure they've got good infection control in place. We are monitoring data coming out of trusts, and we're listening to issues raised with us by staff and the public. And over the next few weeks, we'll be doing inspections, infection control inspections of trusts to make sure where we think there may be a risk or problems, to identify that and, if necessary, take action. So we're very much focused on this, but I don't in any way detract from the enormously strong work that is going on in organisations to try and maintain non-COVID services, such as those in outpatients. And I should emphasise the innovation around using virtual outpatients where possible that was developed during the first peak of the COVID pandemic. I think that was important learning for the long term, both this peak but also in the future as we roll out changes to outpatient services beyond the pandemic.
Ted, thank you very much indeed. And then the second question, I think probably Rosie, this is for you. How will CQC regulate patient access to GP practices in the future when GPs are dealing with COVID vaccinations?
Thank you, Peter, and a really good question. And as I mentioned earlier, we know that primary care is going to play a key role in the vaccination programme going forward. And I know that primary care networks are working very hard to look at how they are making arrangements to roll out vaccination as and when the time comes. I think also we know that there has been huge innovation in primary care in terms of the delivery of service and the use of more digital and telephone access. And we have been really clear for the last number of months that actually people need good access to primary care. They need to make sure that the access they get in terms of the appointments meet the needs of the population and meet their needs. So for some people, a face-to-face appointment will be appropriate. For some people, an online consultation is very appropriate, and we need to make sure that that people get appropriate access for both COVID-related conditions and, as Ted said, non-COVID related conditions. We have continued to regulate throughout the period of the first wave of the pandemic in the last few months, and we will continue to do so. And part of the questions that we ask when we look at practices is around access, and we look at how people are accessing services, and also importantly how practices are communicating the changes that they've made to access to the public that they serve. I think some of the confusion that we've seen is around the communication out to the public around the changes that have happened in the services, and we would encourage practices to think about how they are communicating those changes and working with their patient populations to make sure that they are clear. We are following up concerns and having a risk-based approach to regulation, as we've talked about before, and if we are hearing about concerns about access, our teams are following those up, as well as asking the questions when we go and inspect.
Great, thank you very much indeed, and that is the end of the public meeting. Thank you all. So we are